Yeah, this is a real-world effectiveness of biologic study in one center at University of Rochester. So it's based on their experience. Obviously, this was a descriptive study looking at data from 112 patients who were either started on biologic or switched to a biologic. So if they've been on biologic before, and there were 83 patients who have not been previously treated with biologic, and the rest which were 29 patients, were switched from a different biologic. And so the investigators here, they wanted to look at determinants of response and they defined response by looking at exacerbation reduction, lung function improvement, asthma control. And they classified these patients in responders versus non-responders. Most of their patients, the majority of patients, 43% were on mepolizumab, and 19% were on omalizumab, and 27% were on dupilumab, and then the rest were on other anti-IL-5s. They actually they looked at responders versus non-responders, and then their take-home message was that they present their experience that the majority of patients that were started on biologic responded well by decreasing exacerbation and improving asthma control, which is what they expect. The response, however, was less robust in patients who were previously on a different biologic and were switched. And the variables that were associated with poor response were having a female sex, lower baseline lung function, and former smoking history. So that's another study where former smoking history may affect response in this population. Obviously, it's a descriptive study. It really puts quite more questions than answers, that, maybe there are some patients out there that don't respond to even switching biologic, and they may have a different type of asthma that needs further evaluation. What this study tells us is that it's reassuring, because in real world, it looks like biologic work in a majority of patients, but there are some subgroup of patients that you may not see a response. And we know that from GINA and other recommendation, you really need to give it time. It's not like a one shot, and you want to wait at least 3 months, 4 months to see if the response, if it's intermediate response, continue for 6 to 12 months. That's what GINA recommends. But it sounds like there is a subgroup of patients in real life, even if you switch them to a different biologic, they may have attenuated response. And in that subpopulation, one has to maybe dig deep into, am I treating the right phenotype? Is there a role for more than one biologic? They didn't look at this here. They looked at switching. There are some case reports there using more than one biologic, working through a different mechanism, but that's not been evaluated in a large trial yet.